Welcome everybody, with you Dr. Magdy Razek, consultant of infectious diseases, hepatology and gastroenterology. Our topic today about HIV test. So today we will recognize about what types of tests are available and how do they work. There are three types of HIV tests. One, antibody tests. Two, antigen antibody tests. Three, nucleic acid tests, which is called NAT. Antibodies are produced by your immune system when you are exposed to viruses like HIV. Antigens are foreign substances that cause your immune system to activate. If you have HIV, an antigen called B24 produced even before antibodies develop. HIV tests are typically performed on blood or oral fluid. They may also be performed on urine. Antibody test. An antibody test looks for antibodies to HIV in your blood or oral fluid. Most rapid tests and the only HIV self-test approved by the United States Food and Drug Administration are antibody tests. In general, antibody tests that use blood from vein can detect HIV sooner than tests done with blood from a finger stick or with oral fluid. Antigen antibody test, so drawing blood for an HIV test, antigen antibody test looks for both HIV antibodies and antigens. This recommended for testing done in laboratories and are common in the United States. This lab test involves drawing blood from a vein. There is also rapid antigen antibody test available that is done with blood from finger stick. Nucleic acid test, which is called NAT, this is drawing blood for an HIV test. A NAT looks for the actual virus in the blood. With a NAT, the healthcare provider will draw blood from your vein and send the sample to the laboratory for testing. This test can tell if a person has HIV or how much virus is present in the blood. So this means HIV viral load test. A NAT can detect HIV sooner than other types of tests. This test should be considered for people who have had a recent exposure or possible exposure and have early symptoms of HIV and who have tested negative with an antigen antibody or antigen antibody test. How long will it take to get my HIV test results? It depends on the type of HIV test and where you get tested. HIV self-tested tests provides results within 20 minutes. With a rapid antibody test, usually done with blood from a finger stick or with oral fluid, results are ready in 30 minutes or less. The rapid antigen antibody test done with blood from a finger stick takes 30 minutes or less. It may take several days to receive your test results with a NAT or antigen antibody laboratory test. Can an HIV test detect the virus immediately after exposure? No. HIV test can detect HIV immediately after infection. That is because of the window period, the time between HIV exposure and when test can detect HIV in your body. The window period depends on the type of HIV test. A nucleic acid test can usually detect HIV the soonest, about 10 to 33 days after exposure. If you think you have been exposed to HIV in the last 72 hours, talk to healthcare provider, an emergency room doctor, or an urgent care provider about post-exposure prophylaxis right away. The only way to know your HIV status is to get tested. Knowing your status gives you powerful information to keep you and your partner healthy. Some of the most common questions about HIV testing, including the types of tests available, where to get tested, and what to expect when you get tested. You can also download materials to share or watch videos on why HIV testing is important. What can you expect when you get an HIV test? There are many ways to get tested for HIV. Your HIV testing experience might differ depending on where you get tested and the types of tests offered at a particular location. HIV testing in healthcare setting or lab. If you take tests in a healthcare setting or lab, healthcare provider or laboratory technician will take a sample of your blood or oral fluid. If it is rapid test done by taking oral fluid or by pricking your finger for a few drops of blood, you may be able to wait for the results. If it is blood sample that goes to the laboratory, it can take several days for your results to be available. Your healthcare providers or counselor may take with you about your HIV risk factors, answer any questions, and discuss the next steps with you, especially if your rapid test result is positive. If your test comes back negative and you have not had an exposure during the window period for the test you took, you can be confident you don't have an HIV, such as using pre-exposure prophylaxis. If you if your oral swab or finger prick test is positive, it will need to be followed up with a blood sample to confirm the results. If that confirmatory blood sample test result is positive, the laboratory will conduct follow-up tests. If you receive positive test result, you can take a medicine to treat HIV called antiretroviral therapy, which protects your health and prevents transmission to others. Thank you very much.